I am so honored to be the recipient of this prestigious award and grateful to work in an institution that values innovation and provides support and guidance. Many colleagues assisted me with the Highline, especially Dr. Nancy Albert, Bill Colosi, Dr. Gao, and Amanda Wocelli. In addition, I am especially pleased and proud to thank my son, Nathaniel Hartman, who developed the first CAD drawing and 3D printing of the prototype. Originally conceived in 2016 to address the age-old problem of IV tubing dragging on the floor, especially common in hospitalized children, as IV tubing is a standard length, generally about 6 feet, and children are short. However, when nurses in the COVID ICUs adopted the best practice of placing IV pumps outside of patients' isolation rooms to preserve PPE, this resulted in multiple lines with extremely long tubing draping over beds and snaking on the floor, creating safety hazards for both patients and caregivers. Immediately recognizing that the Highline could play a part in alleviating some of these issues, Nancy Albert contacted Kelly Hancock, and the next day we were a go to develop a prototype that would specifically address the lines in the ICUs. The Highline is a two-part IV carriage system, a stem and a cradle. The stem is 10 inches long and made of medical silicone. The top is an O-ring for placing the device on an IV pole or a wall or ceiling hook, or it can be zip tied around poles or rails. The shaft of the stem has small cones every 1 inch that keep the cradles in place. The stem is flexible and can stretch to prevent tension on vascular access insertion sites when tubing manipulation occurs. Cradles are used to secure tubing in place and are easily added or removed to the system as needed. As part of the adaptation for ICU use, the Highline was revised to allow up to 8 cradles per stem. The cradles are available in 5 colors, thus individual IV tubing can be attached to the same color cradle of multiple Highlines that are used from IV pump to patient. This adds an additional safety feature, allowing nurses to follow their lines of medications from pumps to the patient, like an electrical line between poles. As you know, nurses are very creative, and once implemented, they quickly realized that the flexible cradles could also hold oxygen tubing, enteral feeding tubing, and continuous renal replacement tubing. On routine nursing units, the Highline is used to assist patients when ambulating. In pediatric environments, it is used to assist caregivers by keeping the tubing off the floor when children are in strollers, wagons, or wheelchairs. This allows both parents and caregivers to focus on the patient and not worry about where the IV tubing may be resting. Never in my lifetime could I have imagined a whirlwind such as this. What I can tell you is that there is no such thing as a small idea. Something as small as the Highline is having a significant impact on patient care and safety. Again, thank you, Cleveland Clinic Innovations, for selecting the Highline for this prestigious honor. This innovation has provided me with much personal and professional satisfaction, proving once again that it's never too late to innovate.